This podcast is intended for educational purposes only. Please check out Natural Care Midwifery, our podcast page, for our full disclaimer. Well, welcome back to More About Birth. We have another exciting show for you, and I'm hoping you're tuning in either through YouTube or our audio podcasts. Shannon, who's your guest today?
This is Dan and Lindsay Justice from Justice Family Chiropractic, and they're here today to talk to us about prenatal care and postpartum care in reference to chiropractic, and I'm super excited to hear from them. So,
thank you. Yeah, we're excited to be here.
Talk to me about prenatal care and why in the world do we want prenatal chiropractic care? What's the benefit of that?
You know, it's actually some of our most fun patients to work with. It's because
I think so too.
You know, it's in a lot of ways, it should be some of the most fun times of our lives. And that's just coming from a dad,
From a guy,
and just being able to deal with these pregnant mamas is amazing. It's, especially for our first time mamas that we see, it's just the excitement of joining parenthood, which is phenomenal. And we want to help create, and we love help creating an experience where this is a fun, amazing, wonderful process that mamas have done for thousands of years wonderfully, and to help not create this, fear-based model, which it shouldn't be. It should be a time that mamas can thrive.
Yeah, our bodies know how to do it just fine.
Yeah, right.
Yeah, just fine. So what's the benefit of seeing the two of you during pregnancy? Why would someone want to come?
Absolutely. Yeah, we work a lot with conditions is why people typically come.
Right.
In. They've got that low back pain, those headaches, those things they can't really take a whole lot for, which would normally be a default in America. That's typically what people do.
Pull out the ibuprofen.
Absolutely, yeah. And instead, they're not really sure where to turn. So we work on those conditions, but really then we try to educate our patients that it's more than just the condition. There's a lot of stress that goes on in the body and things as well that we just work through. We have some different ways. We'll chat about that in a little bit.
And especially in pregnancy, there's a lot going on. Yeah.
Yeah, absolutely. And then we also do work with positioning of babies. We do not position babies. But what we find is that when people's alignment in their pelvis is functioning right, that baby can get into a better optimal position.
Well, talk about that for a minute because, we don't have, at least in my practice, I don't have breech babies. I haven't for years. I better be careful. Guess what? The next one will be a breech. But I haven't for years since I've pretty much told everybody you need to see a chiropractor. You need to keep your pelvis in alignment. You need to have everything good to go for this delivery. I have not seen breech babies. If I get one that turns breech, I send him to the chiropractor and it is corrected.
Sure.
So can you talk a little bit about the pelvis and the positioning of the baby and how that makes a difference?
Sure. And I promise I'll keep this as kind of easygoing and not as technical as it gets. But literally, the same way I explain it to our moms in the practice is literally what we're trying to do is that when mamas, especially their pelvis and their sacrum, when everything gets so tight and taut, honestly, when the whole system down there gets stressed out, literally, and all kidding aside, babies look down there and they're like, I don't want to go down there. I want nothing to do with going down there.
Or they'll turn their head this way or that way and go, I can't sit that way.
Now. I'm happy in the hammock, or I'm happy with my feet down there, but I don't want to.
So is that why I came out feet first?
Yeah, probably, yeah.
I'm not going down there.
No. But we utilize a specific technique called the Webster Technique. And basically what it does is we help mama's body relax down there. Everything from pelvic alignment to sacral alignment, which helps with the ligaments down through there. But it creates an optimal environment where babies literally look down and go, yeah, cool.
And they can fit. They don't have to try and figure out how to fit. They just fit.
The ligaments down in there, the uterus is kind of like a balloon. And when it gets tugged to one side with ligaments off, whether that's the ligament that's tight or whether it's the bone out of place pulling that or the nervous system telling it to do that because something else is going on, all of that, when it twists a little bit, there's just not room for baby. And so
I see them coming out this way or this way, and labor takes longer.
Yeah.
So I tell my mamas that one of the huge benefits of chiropractic care is a shorter, less painful labor. And it really is true. Because if baby's in an optimal position, it shortens labor and there's less pain.
Yeah, the body can communicate, hey, baby's head is here. Let's send these
do
contractions and let's move along. Yeah.
Tell me about the Webster's technique in a little more detail. A lot of my moms have fear about going to the chiropractor until they're really in pain. They're like, okay, I'll do it. I don't want to hurt anymore. My back is killing me. And I tell them it'll work.
So it's a 3-prong approach. I'll let you talk maybe on the last part on the ligament work a little bit. I'll talk about the first 2. But it's a 3-step approach. We look at 2 specific adjustment areas. And then the last thing we do is we work on some ligaments. And the first one is we have to work on that sacral area down low. This is where the uterine ligaments come down and attach onto. But we need to make sure that that sacrum is perfectly moving.
Right.
And the reason for that is don't think the structure on this one. Don't necessarily think the bone. But that sacral alignment triggers an area in the brain, triggers nerves in the brain that allow the system to relax. It's what we call parasympathetic nerves, basically our nerves that are needed to relax the entire system.
Okay.
Now, on top of that, we have to look at a second area, and that actually is about as far away from the birthing process as it gets, and that's at the very top. Because the very top actually are 80% of the nerves that allow the system to relax. So first we work on the sacrum, then we work on the very upper cervical part of the spine to really allow every part of the system to relax.
So what you're telling me is that the entire spine, the whole system is involved in what happens down here.
100%.
Okay.
The same nerves that innervate down through the pelvis and the sacrum are also then reinnervated and work at the very top.
So I need to change my thinking a little bit too.
Sure.
Yeah. So when we start changing it out of structure and into nerves, into the nervous system, which is basically what runs our entire system every moment of every day. If we just work down low and we ignore this, we oftentimes miss the entire boat.
Okay.
And we don't get done what needs to get done.
It's a whole body experience.
Yep. And then we have to tackle things from the ligament side at the end.
What about the pain of the adjustment? That's what I hear. Women are afraid. But what if it hurts? Or maybe they've had an experience before, which I've had people tell me that it was terribly painful to have a chiropractic adjustment. And I said, I've not experienced that. Maybe you need a new chiropractor.
Yeah. And, we try to do everything that we can do to make it as comfortable for moms as possible, from, our tables, which we have amazing pillows with holes in the middle of them to make room for belly, or we have specific different tables.
Yeah.
One's called a knee chest table where they're actually on their knees and nothing is around the belly to make it absolutely as comfortable as possible. And especially when we get towards late stage pregnancy and the hormones that are running through the system.
So ladies, if you're dying to lay on your tummy during pregnancy, go to the chiropractor.
For sure.
These pillows get tried to be stolen out of my office every day. Every day. We just try to make it as comfortable with that as possible.
Yeah.
And especially late term pregnancy, when we start getting into that third try and the hormones really start kicking up, the adjustments become that much easier at that point too. When we really are in problematic areas that we know, which some of the homework that we do to figure out where problems are, the adjustments are easy. If we're forcing things or they're uncomfortable, they're not in the right spot. We're not in the right spot.
Okay, so there's no forcing. It's just gentle manipulation.
Gentle, easy work.
Do you use an activator at all? And you can tell them what that is.
Sure. And what we do if we need to. It's an instrument that we can utilize, but most of the time we choose not to because with our hands we can feel. We can know exactly how deep something needs to go, how superficial it needs to go.
Yeah, it's like feeling pregnant bellies.
100%.
Yeah.
So we have it if we absolutely need it, but we try to use our hands if possible.
Okay.
Yeah.
Yep. And then really, we shouldn't have much pain, if anything, with the adjustment. And then the ligaments, the same thing. The ligaments, I am feeling down in your belly for where I find those tight things. So kind of like when you go to a massage therapist, they can find those muscles and they can definitely. It hurts so good kind of a thing with those massage therapy places. But really it's just gentle pressure, not much at all, just to get those ligaments to relax and allow that belly to be able to move forward.
Okay. And is there anything that you can give them, like to take home exercises, stretches that they can work on at home?
Yeah, I quite often actually teach them how to work on those ligaments or their partner to do the same thing so that they can only be with us a handful of minutes, a few times a week at the most, right? And so we try to get them to be able to use that and then do some other exercises.
How often do you have them come in pregnancy? Is it just like a set number of visits or is it more on a need basis?
100% on a case-by-case basis with pregnancy. It depends. If we're working with a mama who's, really have a baby who's stuck in either that transverse profile or in a full breech profile, they could be in there as many as three times a week because it's go time and we have to get the work done. Especially we've had mamas at 41 weeks and, different profiles and it's like, it's go time. We got to go.
I've had people call me that aren't even my clients and say, I have a breech baby. They're wanting to schedule a C-section.
Yep.
What can I do? And I have given them ideas and told them you need to see a chiropractor, but, and correct me if I'm wrong, it's almost too late at that point to get a breech baby to turn because don't you really need to be with them and work on them several times to get the body to stay in that position, to keep baby in a head down position.
Much more ideal to do it that way. Always worth a shot. So
yeah, I tell them it can't hurt.
It definitely can't hurt. And we have seen babies flip on their own after chiropractic adjustment within a day. Typically what I find is once we adjust them and get those ligaments worked on, it's funny, mama lays down, mama rests either that night or that afternoon. We tell them to kind of go home and relax a little bit, and babies just do what they're going to do. And all of a sudden they're like, okay, it feels like baby's in a different spot.
There's room here now.
Yeah.
Well, it's no different than when I go to a chiropractor. It takes me like a day and then everything kind of readjusts. So I would think it'd be the same thing for the baby inside the womb. So
They feel
makes
that.
sense.
Yeah, we've had our fair share of mamas that are 40, 41 weeks though with a single session of Webster work that we're able to get them in an optimal position. Those babies are like, okay, cool.
That's
I'm ready.
good to
I'm ready
know.
go.
Yeah.
We have. I mean, I
That's
obviously.
never our preference.
No, we would love to be seen. If baby's not head down by, as soon as possible, really 32, 34 weeks. We really get a lot.
Yeah, that'll help keep them down there. So what about the benefits of chiropractic actually during your labor? Because I know that you, and I hope I'm not getting you in trouble here, have come to people's homes during labor.
Absolutely.
And adjusted them.
Yeah. The first part, I'll put a caveat into that. Usually when I go during the birthing process, I've taken care of them through pregnancy.
Right.
All the way through. They're not meeting somebody for their first time.
Yeah.
I know what's going on with their system.
Right.
They're a part of our family at that point, basically, and we're able to push on. But same thing during the process, and I know we'll talk about this in a little bit, but everything that we can do to make sure that that system remains in a calm state throughout the birthing process. The last thing we want is mommy's body to be in a more, survival, stressed out mode throughout the birthing process, because when we can just get it to relax, it really, really starts to drive that process forward.
It's all about relaxation.
100%. 100%.
Yeah.
So I just saw an example of that at the birth of one of your patients or clients. Would you call them patients?
Yeah, patients.
Okay. So her labor was great. I mean, it was still labor. It still was uncomfortable. But the way her body handled it, I really noticed a difference. And I know that she had continuous chiropractic care throughout the whole experience. So I got to see that firsthand.
Love it.
And then postpartum. Tell me a little bit about postpartum chiropractic care.
Love it. So as a mama of 3 myself, it's funny how we're all so, we're so excited for this birth and we're so excited to meet the baby and we do everything. And all of a sudden you have this baby and you're like, oh, I could do this again 1,000,000 more times. Right. And then Shannon looks at me and says, are you sure? But so really it's after that birth process, your body has just gone through a major athletic event. Yeah. So not only do you need to now kind of reset where your pelvis is and things like that, but now you're doing things like holding a baby, breastfeeding a baby,
nursing,
and all day
so
long.
Much back trouble.
We do see a lot of that upper mid back sort of stuff.
We refer to it as beautiful baby syndrome.
Yeah, where you're looking,
everything's just down. We're here all the time.
See a lot of that.
I always tell them, sit up straight, get yourself totally relaxed and comfortable, bring the baby to you.
Right.
And doesn't it make
may be there a while?
Doesn't it make sense that you're carrying it lower when you're in the 9 months and then all of a sudden you're carrying it higher, right?
Everything
that's what
shifts.
I visually saw. So that could throw your body into chaos.
Yeah, a little bit.
Yeah.
Absolutely. And so we definitely see a lot of that. A little more neck stuff as well. Typically, again, you're looking down a lot, or a lot of mamas that are co-sleeping, you're doing, this movement to make sure that baby's safe in your arms.
And you sleep a little bit stiffer when you're co-sleeping.
Yes. Sure. Yep.
And the body just doesn't get as much recovery mode typically. Moms aren't sleeping as much. And this is just first-time mamas. And then if they're still in mom mode throughout the day with other numerous older kiddos and then not sleeping as well, their body can't recover. Yeah. And again, it comes back down to that. Yeah,
and you guys, with your patients, have been known to come and do immediate postpartum adjustments on mom and baby.
Yep.
It's awesome.
Yeah, we just had another baby born last night into the practice.
So we'll be going
there seeing mama and all that kind of fun.
House calls, huh?
Yeah.
Chiropractic house calls?
Yes.
So,
that's
I
awesome.
love it. Okay, well, we're going to take a break. And when we come back, I think you have something exciting to talk about that's kind of eye-opening to me.
Yep.
Absolutely.
All right, we'll be back.
Well, that's the first part of More About Birth today with Dan and Lindsay Justice from Justice Family Chiropractic. And we do have a hot topic. We're going to talk about how to deal with stress and release some really good feelings during that whole pregnancy process. So stay tuned. We'll be right back. This podcast is intended for educational purposes only. Please check out Natural Care Midwifery, our podcast page, for our full disclaimer. This podcast is intended for educational purposes only. Please check out Natural Care Midwifery, our podcast page, for our full disclaimer. Well, welcome back to More About Birth. This is part 2 with Dan and Lindsay Justice from Justice Family Chiropractic. And I'm excited about this next topic because I never thought about it before. So, Shannon?
Yeah, kind of eye-opening. So my moms, when we talk about adjustments with chiropractic, it's usually pain-based. Their thought is that they're going to go in and have an adjustment and everything's going to be great and hunky-dory. So there's another part to that, though, that you mentioned. Do you want to talk about that?
I would love to. You know, it's one of the things that, again, we're super passionate about with moms is educating them about what we do. And again, most moms, when they come into our practice, they're thinking pain-based. They're thinking an adjustment to a piece of structure like the pelvis.
You're going to
or
fix
the
my
sacrum.
pain.
I'm going to feel better. And don't get me wrong. I mean, the adjustment is what we do. You know, that is what a chiropractor does, but it's what the adjustment does.
Okay.
That's the difference. And it's all about neurology. You know, we try to get our moms to think differently out of the mode of structure pain to an adjustment and how it affects the brain. And that's where the power of chiropractic comes. And this is why the vast majority of our mamas that we see is throughout the entire birthing process.
Right. And that is the best way.
If we actually have our way, we actually talk the preconceiving part of chiropractic care with mamas, which let's help get your body working at its best.
I actually was going to ask you about that. That's great. So you
Yep.
do work on pre-pregnancy.
Yep,
Okay.
100%. But everything about balancing the two sides of the brain. And what I mean by that, and I promise I won't get too nerdy. But
Go for it. Man.
Yeah,
we need some nerds around here.
Feel free to intervene anytime you want to. But literally, our brains, we have two sides to our brain. We have a side of our neurology that deals with our survival mode, which is our fight or flight response. When our body gets stressed, it needs this side of the brain to make sure that we can run for our life, fight for our life, and survive.
Right.
But the other half of the nerves of our body, what we call parasympathetic nerves, and these are the nerves that are responsible for us thriving in life. They're what are responsible for us staying calm and understanding our digestive tract, our immune system, our cognition, everything we need to stay nice, calm, and relaxed.
We need more of that.
That we 100% do.
Seriously.
I'm all in, man.
I know, right?
Keith's getting an education.
I'm ready for an adjustment right now.
I need an adjustment. I should start doing Pilates. I need to.
Yeah, exactly.
100%. The problem is, though, is that those two sides are what we call inversely proportional. When one gets elevated, the other one doesn't just stay put working great. It actually gets pushed to the basement and it becomes downregulated at that point, which is why I think about this. Let's just talk adult based for a minute. When your body's in stress mode, this is when you typically get sick. This is when you crave foods like sugar-based because you need fast energy so that you can survive, right?
Sleep.
You can't sleep. You can't understand.
You're
you can't
describing me.
Right?
You get what?
Yeah, you're
pregnant brain,
professional, so
mom
doesn't
brain, right? No, at that point, right? And so when that happens, our major job and the two biggest areas of that parasympathetic, that thriving mode, the neurology, comes through the pelvis and the sacrum. And then also at the very top. So the two biggest areas we work on with moms is to teach the brain and then keep it understanding to run those areas.
How do you do that?
So that's purely through where we adjust and how we adjust.
Okay.
Is through that area. So yes, still the adjustment, still the part people think about there, but specific areas to trigger specific sets of nerves.
So tell me about these scans that you do. I have people tell me, so Justice Family Chiropractic does these scans before they adjust you. Is that safe during pregnancy?
Yes. So we do scans. Most patients will either do x-rays, obviously not our pregnant patients and not our little ones, but we like to see the structure. So most adults will do x-rays, or if there's an indication on
and do you do those right there in the office?
We do them in the office.
Okay.
And then we also do these nerve scans on every patient that we can. Infants, we can only do one of the 3 scans just because they're wiggly. But other than that, we do 3 scans. It's all either infrared, thermal. It's just measuring topically kind of muscle action, different things like that. And you can explain a little bit about what those 3 scans measure.
Basically, they give us a snapshot of how your nerve system is running, and we can look at the balance between those stress side of the nerves and those nerves that are giving us the ability to stay calm down. And we can see then also the memory of the brain, and that's the biggest thing is that, you know, most people think muscle memory, right? Like we build a muscle memory. You actually, to be honest, that really doesn't exist. We always have brain memory. And so the brain can develop a memory as to how to turn these on or off, or which one it flexes all the time and which one it doesn't utilize very much. And we want to see a snapshot of that. That way we can walk moms through this pregnancy process.
Are you seeing like a different color field for
it's colors,
areas
it's
that aren't
pattern
working
scans.
well and areas that are?
Yep.
So like a thermal heat scan.
Exactly. And it gives us kind of an indication of what's going on, where it's going on. Does not tell us exactly what to adjust, but we can kind of take that and put it into what we're figuring out for you, which is why every care plan is a little different for a patient.
So do you ever go back and do the scans again later?
Always.
And
Every
see?
12 visits we do during a acute phase of care. If someone's more of a wellness, like, hey, I just want to keep my body functioning well, we check them about every 6 months, or if there's an indication to do them sooner. But there is no pain, there is no radiation. It's very safe on everybody, and it's
totally safe
awesome.
for pregnant moms.
Totally
Absolutely.
safe. It doesn't add anything into the body. It just takes readings, which is completely
So
safe.
the other question I get a lot is, I can't afford to go to the chiropractor 3 times a week. And how much is all this going to cost? So you guys are covered by major insurance?
Yep. Almost all insurances. There are a couple that we are not in network with, but most we are.
Okay.
And within that, we take your insurance and then we take what your diagnostic profile looks like. So we actually don't typically adjust the first visit because we want to know what's going on with you.
Right.
And then from there, we'll explain it to you and give you all the financial side before we decide what care path to take.
Yeah.
And so before you would ever get adjusted, you would know what your insurance does and doesn't cover. How many visits we're recommending to get you back to optimal health, or to get you through this pregnancy, depending on
Kind
what
of
you're
like
coming
your
for.
dental plan when you go in and they want to
Exactly.
do all this work and give
Yes.
you
Yes.
estimate of
Yep.
of
And
care.
And it's definitely person by person. And some people need more than others, and some people need less, and they're pretty much good to go. And
So a lot of my clients are cash pay. They don't even have insurance.
Yep.
So how's that work?
which 100%, a lot of our patients are going that way anyway. Even our patients that do have insurance are recognizing that their plans are more expensive than our cash rates.
And
we do
their
specific
plans stink.
discount.
Yeah,
We
exactly.
offer tons of discounts if they're cash pay.
Right.
Just to make it as easy as affordable as we can.
We always offer 3 options for payments, depending on how they want to pay. And then from there, we do, like if you're a state insurance patient, we do have some flexibility as far as payments when it comes to that as well.
What about some of the share programs like Samaritan?
They're our favorite. We love them.
Me too.
Yes,
They're
we love
so
them. They're
easy
amazing.
to work with.
So
great to work with.
Samaritan covers 40 visits, whether it be chiropractic, massage, or other therapy for any condition, illness, or injury. So
Good
no
to know.
problem. We do it. We can help you with that $300 discount because you actually get a discount for paying in full because it creates less work for us to have to do. And then you just submit it and you get reimbursed. They are so easy for
They're a
us
great
to work
company to work with.
Yeah,
really
they are so easy.
with. We love them.
Okay.
So instead of having all that chocolate and going out to eat at Applebee's, you should take that cash and go see your chiropractor.
Yeah.
You're going to feel better and have less stress, right?
That's
Yeah.
very true.
Yeah.
Definitely.
Yeah.
Well, talk to me a little bit more about the whole nerve thing. In my mind, I'm visualizing all these nerves running down my body and some of them being pinched or tweaked or just tell me a little bit more about that.
So literally, I want you, when you think nerves, I want you to think, and this is where we'll tie back into chiropractic, is actually, when I love to think about nerves, I love to think about them kind of like TV input, right? So nowadays we live in the HD world, right? Everything is 1080p and above. There's probably more since I've talked, about what it is nowadays, right? But nerves they should have clear cut instructions. Nerves are an instruction superhighway, right? And the clarity of those instructions should be 1080p. But the more restriction, the more lack of motion we have in an area, the less clear those become. And the less clear they become, the more they trip those fight or flight nerves to then begin to fire at that point. And the biggest thing becomes memory. And so just like anything else in life, the more you work something, the better it works for you. And so the more we stimulate those parasympathetics, the more we allow that kind of thrival side to work for you, the more your brain remembers to run that when you do get stressed.
So give me an example during labor, how that would
Let's
work.
just talk labor in general. So the more your brain has learned to run those parasympathetic nerves throughout the pregnancy, the more when you start into that labor process, the calmer your system is going to be. The more your brain is going to remember that even though I'm going through this amazing athletic event process right now, I can chill. And it's not even a conscious, I have to remember to do it. It's going to do it for you.
Wow.
Hence
That's
those
great.
shorter
Great.
labors that you're talking about.
Yep.
Yeah. And when a pregnant mom comes in to see you, about how long would her visit be? They're all on a time crunch. We've got kids and
We
can
love
you
it.
bring your children with you? Do you prefer not so that you can
Sure.
Have
So-
a more calm moment at the chiropractor? Or?
So our office is super, super family friendly. The first 2 visits, we recommend about 45 minutes or so to plan in your schedule. We will work with you to find that time. We'll get everything taken care of. Then the adjustments are real quick. Usually you're in and out of the office within a handful of minutes, 10, 15 minutes maximum.
Okay. Yeah.
We are always holding babies, always reading books in the Jeep in our kids
are
area.
running around like it's a track.
There's a
Yeah,
kids.
that's great kids play area.
We do, and they can't get out unless they're big enough
They're
to reach
trapped.
over and help themselves. But we can watch them for you, and we have diapers for messes that happen.
You've got a
We've got all
great
the
changing
stuff.
station in there.
We
and everything.
always have kids there, so we always ask Mama, don't put yourself on the back burner
Yeah.
because you don't have a babysitter. Bring your kiddo with you. It's
We
fun.
all have kids.
They play.
We
Yeah.
get it.
Sounds
It's our life
good.
too.
And I know I had a client not too long ago that would come at the crack of dawn in the morning for her adjustments because in her schedule, that was the only thing that worked. So what are your hours?
Yeah, it's awesome. Technically our
'Cause
website
you get up early.
and Facebook say,
what does it say?
8 to 12:30 in the
Right.
mornings, but I'm usually to the office by 5 or a little after. And so,
Wow.
I usually will have patients trickling in by 6 o'clock or a little after. And we just
there
offer it as a
before
service
work.
for patients. And I never worry about it just because if that's what works in their schedule, we're trying to calm their whole system down.
Right,
The last
right.
thing we want to be is another added stress load because of schedule. And so we try to be as accommodating as that as we can.
Great.
Quite often see those mamas, and we see or dads, and then we'll also see kiddos before school.
Yeah.
So we have a chunk
Oh.
of kids that'll come in, like especially our athletes that come in.
Yeah.
I'm like, they're always at practice all day
Right.
after school until 9 p.m. Right?
Right.
And so we quite often see them in the morning as well too.
So where are you guys located?
We're over by the Toyota Center in Kennewick, about 2
Okay.
blocks from there.
And they have a beautiful new office.
Yeah, we're very blessed.
Yeah, it's been fun.
Yeah.
And that's
and
in
they're
Washington.
kind enough
That's
to
in
let-
Washington for our Ireland
Yeah.
listeners.
Yeah,
that's very
sorry,
true.
we're over here.
They
There's
have
good
a
But I'd love
beautiful
to come
office
visit.
that I've been able to
Yeah.
use even.
A shout out to Ireland if you're listening today.
So I am excited that you've shared that you're going to come back into the practice again. Lindsay's been kind of doing the mom thing for a few years now.
Yeah,
Kids are getting older.
We have our 3. They're almost 2, 4, and 6. And so finally, I think it's time that we
Yeah.
get me back in the practice. Dr. Dan has seen all the patients and has done a phenomenal job. But there is also something about a mama's touch for some of our mamas.
Oh,
So,
Yes.
beyond measure.
he does a
Yes.
phenomenal job. He took
So-
care of me and all of our team when they've all been pregnant, and does a great job. But I'm ready
What
to
will
back.
your specialty be? I mean, as far as will you see most of the pregnant mamas at that point?
We
or-
haven't entirely discussed that. That is my love for sure. The prenatal and those kiddos. I just
Yeah.
love them. And so, mom to mom, I can do a lot of the
Awesome.
understanding and the talking. We're really
I'm excited about that.
So am
Yeah.
I.
A lot of
So-
moms specifically request a female to do
Yep.
work on them, and some of the adjustments. I know even the Webster can be a little bit
Yep.
Yeah,
personal.
it is. Yeah.
Yeah. So sometimes they just want a woman.
Yep.
So what is your web address so that we can find you?
Sure. Yeah, it's justicefamilychiropractic.com. It's real easy. If you Google Dan or Lindsay
Easy.
Justice or justicefamilychiropractic.com, will come right up on there for you.
Okay. I am so glad you guys came today. Thank you.
Thank
Lots
you. It's
of
been fun.
really good information, and we're going to look forward to seeing you back again.
Yes, thank you. I
Thank you
appreciate
very
it.
much. We appreciate it.
Well, thank you for joining us here at More About Birth. You've learned some things about chiropractic care for mom, for baby, and even dad during the birth. So we hope you'll stay tuned for more podcasts just like this, and we will see you here next time on More About Birth.
See you later.
This podcast is intended for educational purposes only. Please check out Natural Care Midwifery, our podcast page, for our full disclaimer.